At the College of Veterinary Medicine at Texas A&M, we have scientists who do clinical trials and preclinical trials in animals. And next in our virtual visit, we're going to show you some of their labs. I'd like to introduce you to Dr. Heather Wilson, who's a small animal clinician here at the College of Veterinary Medicine, and she specializes in cancer of dogs and cats. And we're in what you might call the war room, where they have records of the different cases and what their status is. And so maybe you'd like to tell us a little bit about what goes on in this room, and then we can talk about other things.
Sure. So here's where we actually take in all of our patients, and we do a lot of our treatments, draw blood and get samples. And so initially we have a board here that's set up for clinical trials, and all of these patients are enrolled in clinical trials. We're collecting samples, keeping track of them, administering medications and things at appropriate dates. And then this board is our regular patient board, and some of these dogs are also on clinical trials and in both places, but most of the time these are the patients we're going to see each day, their names, when their appointments are, what their problem is, and then what the plan of attack is for the day as far as what treatments or diagnostics they're going to get for their workup. And so as the day goes on, we check the board off and then send them home.
Okay. We're in Dr. Wilson's lab right now, and we wanted to explain to you a little bit about how she does the clinical trial work here in the small animal clinic. And you do, as I understand it, clinical trials for drug development for dogs and cats, right?
Yes, sir.
Among other things you do, which we'll talk about in a minute. Could you explain a little bit about some of the equipment you have there in the lab and how you use it in your clinical trial tests?
Sure. So the clinical trials that we currently have going on involve many facets of veterinary oncology, and one of them is simply looking at the bacteria in the gut and comparing it to before and after chemo, because chemotherapy can cause diarrhea, and we want to find out why exactly that is. And so that's a simple matter of collecting fecal samples and looking at the DNA of the different bacteria that are in those samples before and after. And that's done using very simple tests and some of the equipment here, which I'll explain in a minute. Additionally, we are doing tests for dogs with lymphoma, where we're actually taking lymphocytes or white blood cells, kind of the army of the body that's used to protect the body from infection and other things. We're trying to take those cells and make it so that they will actually attack the dog's tumor. And so we're going to draw blood and take those cells out of the blood and then introduce them to the tumor in a way that would make them recognize it as something bad. And then we can put it back into the dog through an infusion, like an IV infusion, and then hopefully those cells will remember what we've taught them and attack the tumor cells in the dog's body just like they would if it were a bacterial infection. And that's one that is currently going on now. And then in addition to that, we also have another clinical trial for dogs with melanoma. And melanoma is a tumor of pigmented cells, the ones that make you tan when you go out into the sun. And those particular tumor cells are pretty aggressive, but a lot of times we can get the body to recognize them also as something that's bad, like a bacteria. And so we're going to give these guys drugs that are just like chemicals in the body that stimulate the immune system. And we're going to attach those little chemicals to antibodies that are specific for that type of tumor, so that when we give it to them, the antibodies will kind of taxi the little chemicals straight to the tumor, so that the immune system can recognize those chemicals and know that's where they're supposed to attack. And so those are the three kind of trials we currently have going on in oncology. How we would use this equipment associated with that depends on the type of tumor. This right here is a thermocycler. It's a PCR machine, or polymerase chain reaction. What you do with this machine is you actually look for DNA of a specific gene. And so if there's a gene that you think might be mutated in cancer, you can use this machine to try to find it specifically in a sample. And so for tests like the fecal test that we're talking about, we could use this machine to identify DNA. Also, for any other type of tumor, if you want to know if a specific mutation is associated with it, you can use this, and this can find that particular type of DNA in a very, very, very small amount of tissue by amplifying it thousands and thousands of times so that even the smallest bit of DNA can be found. This piece of equipment here is a simple centrifuge, but it's refrigerated and lets us centrifuge cells and samples at a temperature that keeps them from breaking down, and is useful for things like PCR and other tests. Here is an incubator. Now we use incubators for cell culture. And when we do cell culture techniques, essentially we keep them on little racks in here, and it's humidified. There's a tray of water down here to keep the humidity up, and it's kept at body temperature, and it's kept at a carbon dioxide level that is similar to that, so that these cells have an environment that's happy for them, much like the body, that allows them to grow and proliferate, so that we can take cancer cells, and just the cancer cells, and study them individually without having to use any live animals to study cancer. This here is a sterile hood, and what we do in this hood is we do cell culture techniques. So when we have the cells and we pull them out of the incubator, if we want to collect them, or if we want to put them in a petri dish, or do anything special like count them, we do it all under here wearing gloves, and you sit in under here. There's a UV light to help sterilize it that we can turn on here. The UV light will sterilize this area, and then when you work with the cells, you just turn the regular light and the fan on, and that fan keeps the air going this way. Keeps the air going this way, so that no air from the outside can blow in and contaminate your cells, so that everything stays clean under here. And so we work this way, usually with sterile pipettes and things to work under with our cells. This here is a liquid nitrogen tank. Liquid nitrogen tanks are used for long-term storage of cells and cell culture. And in this tank, you essentially have several different cells cell lines that we keep in here frozen, and they can remain frozen for years this way, so that when we need them, we can pull them out, and then if we don't need them, they can stay in here and alive until we pull them out. Or we have a box here with about 15 different cell lines, all from canine, feline, and human tumor cells that were developed from real tumors that happened in real animals or real people. And so that's how we keep them, so that we can use them. And then here is just a simple water bath. And these are the ways we heat these cells up. So once we take them out of the freezer, we have to slowly thaw them so that they don't die. And so this will thaw them slowly to body temperature and keep them warm. We also heat up all our media this way and everything else, so that the cells are cozy in a little bath of nice warm media, instead of being shocked into cold media when they go into their flasks. So this is one of our oncology patients today. And she has multiple tumors here. As you can see, every one of these little red bumps is part of the same tumor that's in her skin. This is a mast cell tumor, which is the most common skin tumor in the dog. And this has also spread to her lymph node and even to her spleen. At this point, I don't have a current clinical trial for this type of disease. However, clinical trials in the past have focused on specific mutations in growth factor receptors for this type of tumor, and how to inhibit them. And there are new drugs that will be available on the market soon that may help dogs like this out with these types of tumors.